Now it gives me great pleasure to introduce Tom Kochan, our next speaker. Tom is Professor of Work and Employment at MIT. He focuses a lot of work on employment policy and the economy and has had many years of partnership with Kaiser Permanente. So please join me in welcoming Tom Kochan.
Thank you, Janet. Thank you, Janet, and good afternoon, everyone. It's delightful to be here to talk about this partnership that we have had with Kaiser Permanente and their workforce and their various unions that have joined together in a coalition of unions and in a labor management partnership. So what I'm going to do is to review a bit of the work that we have done with them, the nature of the partnership that we've developed at MIT and how we work with our research partners in the field, and to discuss basically how we can bring the workforce into healthcare improvement, and to do so with innovative labor management relations and innovative organizational processes. So just a bit of history on how we work together. In the year 2000, about 3 years after this partnership was first formed, Kaiser Permanente and their union partners contacted us at MIT because we'd worked on these kinds of issues and asked us to track their progress in working together. And since then, we have worked now for about 15 years together in looking at how the partnership evolves, what it's been able to achieve, doing independent research, which we have published in the usual kinds of places, but also what we call, as you've heard today, action research, working closely to collaborate with our partners in the field, providing feedback to them, urging them on to address some new issues, criticizing some of the things that they are doing in a constructive way, and working together. So we've done a lot of feedback, a lot of workshops. We've briefed the parties before they've gone into labor negotiations. We've provided facilitation from time to time for various groups to solve problems, and we have continuously collected data as we've gone along and then published some of the results. So let's talk about this very, very unique relationship. I don't know how many of you are aware of the nature of labor management relations in this country, but what I'm going to talk about is the boldest, biggest, largest, and most successful, innovative labor management relationship in the country. We have never seen a highly unionized organization, whether it's in manufacturing or healthcare, come together the way these parties have out of crisis in 1997. After a number of years of wage cuts, strikes, concessions, layoffs, very tumultuous period of time, as you all know, in that particular decade. And in fact, consultants from McKinsey, I hope I'm not insulting anyone in the room, but McKinsey said to Kaiser Permanente, which we now look at as a model of an integrated healthcare provider, you ought to break yourself up into a hospital unit and an insurance unit because this ain't working and it won't work in the future and it's too complicated. They rejected that and instead worked and turned to their unions and said, let's try a different way. And together they've built a partnership where they've brought state-of-the-art labor management problem-solving tools together to work on healthcare problems and on their ongoing relationships. So in the first decade, it was a lot of relationship building, demonstrating that they could solve problems together. They reversed what were financial losses and turned it into steady stream of whether it's profit or revenue, positive revenue growth and positive margins, since it's a partially nonprofit, partially profit-making institution. That has been consistent since this partnership took off in the early 2000s. They've had a decade of labor peace in the early years. They became an industry leader in introducing electronic medical records technology with an employment adjustment and security agreement so that they could retrain and redeploy the workforce and engage the workforce in making those technologies work effectively, and we've monitored that and documented how the combination of the technology and innovative work practices have driven performance. And they've gone on to do this while keeping their wages, benefits, and doing some innovative kinds of training in the employment side, all intact and advancing it. Since about 2007, actually out of the 2005 negotiations, there was an agreement to accelerate the process on the front lines. And I'm going to focus on that because they are now an industry leader in introducing what they call unit-based teams, which basically are teams that focus on the patient. And this is their symbol of what this partnership is really focused on, focusing on patient, and in their case, membership, members being the people that they serve through their insurance unit, focused on improving affordability, quality, service, and making Kaiser a great place to work. And so this focus is what they chose to use to now generate a whole series of unit-based teams. Frontlines, nurses, technicians, service employees, doctors, pharmacists, all focused on improving patient care and finding ways to work together in new ways to bring patient care to the forefront of everyone's attention and to bring the labor management tools of problem solving and engagement and constructive negotiations using a lot of the state-of-the-art modes of negotiations that we now teach in our own programs and bring those to bear in improving patient care. Lots of training on problem-solving techniques, what we call and others call high-performance team methods. It's sponsored jointly by union and management leaders, and it's supported by the Office of Labor Management Partnership and evaluated and tracked accordingly. So right now they have about 3,460 or just about 3,500 teams at work. So let me show you a few of the things that they work on, what they've achieved, and then we'll talk about where we're going in the future at Kaiser, because this is a very good step in a very positive direction for continuous improvement, incremental improvement at the workplace in patient care. So the largest set of issues that they address are on improving affordability and cost control, followed by service. That's the majority of the topics and projects that these teams take on. They choose their own projects, but they choose their projects in conjunction with a consensus on what are the critical issues and strategic concerns within our region, because Kaiser is organized into decentralized regions, and within the particular unit that they happen to be located in. And then there are many other issues. I've seen some very effective teams working on both patient safety and worker safety, and you're going to see some numbers on some of the achievements in that area in a moment. I've seen teams that have worked on absenteeism, an issue that is of particular concern to healthcare institutions so that they can make sure that they have the continuity of care that's needed. I've seen teams work creatively on making sure these technologies, these wonderful electronic medical records technologies actually get used and get accepted not only by the workforce but also by the patients. Lots of different topics that are possible with this. They have a metric for measuring how high performing these teams are. When you start off, they tend to take on small issues, then they take on bigger issues. It takes a while to build the kind of cultural norms of teamwork and problem solving, and so they have 5 levels of achievement measured carefully by a set of metrics. And you can see that they have moved from, in 2010, they have increased the number of teams that are at this high performing level, that is level 4 or level 5 in their metrics that they use. So now about 70% of their teams are at that level. And that's a real achievement for team building and progress. Well, what have they focused on? What have they achieved? Those of you who capture data on hospital satisfaction with the standard measures know that moving it by 1 percentage point or 2 percentage points is a big deal. And here you see across a number of different ratings, from the overall ratings to recommended, willingness to recommend the hospital as a place to get health care, to communications, which is obviously, we all know, critical in the handoffs and in quality of care to cleanliness and other measures. There's about a 5 percentage point bump when we move from the initial stages of these teams to this high performance level. So it has measurable effects there. It has measurable effects on patient safety. This is a measure of, again, the difference between high-performing teams and the ones that are starting off at a lower level on infections from in hospitals. And so you see about a 25% reduction in the rate of line infections measured by line days, something that, again, I think everybody in this room knows is really critical. The same on workplace safety. This has been a big concern and one that, with back injuries and other kinds of things and moving patients in hospitals, and some of the teams have really focused on this in a couple of the regions, and this shows that, again, you get about, in this case, a 29% reduction in workplace injuries with high-performing teams. I'm going to show you two numbers, or two charts now, that indicate that these are well received as they develop. Doctors, I'm sure this is shocking to everybody in this room, but the doctors, the physicians at Kaiser, weren't great fans of this whole idea. I don't have time for this. I don't have time to work in teams. I tell my my staff what to do. They're good people. I assume they do it. Well, over time, doctors and other managers, as these teams have evolved and as they've seen the kinds of problems that they can solve, practical, not theoretical, and not just training for problem solving, but training to really focus on clinical care, they have become stronger and stronger supporters of unit-based teams. And you see the numbers here moving from about 60% to 75, 73% when the teams perform well. So there's support from the people who oversee these teams, doctors and hospital managers. And you see the same thing from the workers. And in fact, in other work, we have shown that satisfaction not only with the labor management partnership, but with their basic union representation is higher when you have effective teamwork and when these employees are engaged in these teams or engaged in the partnership. So this is a process that has worked well, not without many bumps along the way, not with a lot of setbacks. We have some people in the room who can talk about the complicated processes that are involved in getting a mega system that has over 100,000 unionized employees to work together with physicians and with their other partners. But they've been able to do this and increase the satisfaction of both managers and team members in using these kinds of processes. So this has worked quite well. This, I think, is a good example of what we can do when we work together, when we engage the workforce, when we treat the workforce with respect, when we build on the skills and knowledge and energies and commitment, and when we do the same thing by building respectful relationships with union partners if it's a unionized operation. This is why this has been such an exciting partnership for us at MIT, to track this over time, to help it through some very difficult crisis points. When someone does something that's wrong, inappropriate, breaks some of the kind of norms of partnership, you have to go back and address those issues in a straightforward way and use the tools of problem solving and negotiations to put things back on track. And when you do that, the parties have often found that by facing those issues directly, they strengthen the commitment to working together and continue to move forward. So it's had a lot of bumps in the road. It doesn't have the support of everybody in the organization. I can tell you it has the strong support of the leadership. It's Bernard Tyson at the moment, but his predecessors, George Halverson, and before that, Dr. Lawrence, who helped start this. Without that support, it wouldn't have continued. Without the support of the union partners and union leaders, from the top of the labor movement to the top of the coalition to the rank and file leaders on the front lines, you wouldn't get this kind of achievement. But that's not enough. Now we're in a different world. And so the last project that I took on with Kaiser was to ask, given the changes in healthcare delivery that are coming along, what do we need to do to think about the future? And this slide is really one that anybody in this room could have probably put together. It happens to be Kaiser's version of their notion of where healthcare delivery is going. And they talk about three elements: engaging the patient in different ways through consumer-based healthcare and patient-centered healthcare, which you've talked about all day here today. Doing it in different places, encounters and settings. That means going out into the community and into the homes. And as one of the questions in the last session suggested, the coordination of inpatient hospital or clinic work with people in the community in their homes, or maybe even their places of employment as some this work is going on. And to do it with new forms of teams, not just the teams in the hospitals I just described, but really much more diverse teams. Teams working with community navigators, teams working with the patient and the family and the caregivers and the home-based caregivers that are central to delivering for particularly complex patient populations. Working together with technology, using information, using more data, the kind of data analysis that you've talked about before today, and you're going to hear more from my colleague Dimitris in a few moments. Using these tools to reach patients wherever they find them and wherever patient care is now delivered. That's a radical change for Kaiser Permanente. That's not going to happen through incremental improvements in teams within a work unit. This is going to call for reconfiguration of the teams and who's working together. It's going to call for changes across worker jurisdictions, across the service levels, and working right up to, I won't say beyond, but right up to one's scope of practice, and getting people from different disciplines and often different organizations, social workers, nurses, nurse practitioners, physician assistants, patient advocates, community navigators. All of these people have to now learn these problem-solving skills and work together. And so we've done an external scan with the help of some MIT students on what's going on outside of Kaiser, and then we did an internal scan and an inventory of the many, many innovative efforts that are underway at Kaiser. Those of you who know Kaiser will appreciate this. It's decentralized, as I said, into multiple regions. Regions are king or queen, depending on who is the president and who's the chief physician. And they don't often share a lot of information, but they are where the innovations come from. And so we've tried to create more of a learning process by identifying some of the examples of innovation that are going on. These are just some that were presented back to Kaiser in an internal briefing and discussion of how do we enhance the learning. So I'm not going to go through them, but there are examples across the country from middle Atlantic states here in this end of the country to Southern California, to their Northwest region in Oregon, to Northern California, all across the country. Lots of innovative examples are going on in bringing these new models together with the workforce and with the partnership, and sometimes without them, because sometimes actions are just taken on the basis of innovations that a particular physician or a particular unit comes along and has in mind, and so we have to find ways to draw on those examples as well. So there's lots of things going on. Then we had a very, very frank discussion. Is this labor management partnership up to the task of really embracing these new innovations, working with them, enhancing them, and moving them forward? And there's lots of implications that we've learned from the past about how you integrate technology with the workforce. So if you just throw the technology out there or do it top-down, the evidence is it doesn't get a rate of return or a payoff for a very long time and sometimes never. But if you engage the workforce in the design and implementation, you're going to get a much higher rate of innovation and higher rate of usage and a higher rate of return on one's investment. And we went through a series of that, pointing out where they're doing it and where they're not, and then talked about the kind of challenges and opportunities that they have moving forward. So this is just an example of the kind of work that we do with various employee groups. Our research group and our unit at Sloan has had a long, long history of promoting innovation in work organization, of demonstrating that we can do this better when we bring the workforce in, the people who know their work better than anybody else, when we bring them into technological design, when we bring them into organizational change in an early way, when we get their advice on how to make all of this stuff really work, and when we reward them for participating in constructive and positive kinds of ways, wonderful things can happen. And when we leave them out, we do so at our own risk, our own expense, and at the loss of the kind of patient-centered care that this partnership has been so focused on. So we see the next challenge to move from the incremental to this more radical or fundamental organizational set of changes in bringing this kind of care delivery process. We know that workforce partners and the unions working together have been successful in bringing about some of these changes, a long way to go, and we're anxious to do this kind of work with partners around the country in other organizations, unionized, non-unionized, or mixed groups, as you have in many of your settings, to see if we can't really advance the delivery of healthcare quality, address the cost pressures, address the service delivery pressures by working together. So that's the kind of work we do. It's very interactive. It's not sitting at our desks at MIT and just analyzing the data and then sending it back. It's, as you've heard throughout today, very much in the spirit of the kind of action research we believe so strongly in, and we look forward to working with you on it. So thank you very much. Happy to take questions or comments or similar experiences. Yes, ma'am. We have a question right here.
Oh. So I currently work for KP, and this was the first time that I really was engaged in the improvement process for the unit-based team. And one of the things I found particularly rewarding...
Could you just speak up a little bit?
One of the things I found rewarding about this process was the investment of business literacy skills for the team. So to really have that shared level of education to all levels, from your medical assistant to the physicians, everyone was educated globally on business literacy, on impact, on leading change.
Mm-hmm. That's absolutely essential. Without that, you don't have very informed decision making. But I think that's when you engage and you provide a little bit of education, you find out, at least in the settings that I've sat in, we've got 2 people here who have done this. You find out how much people do know. They might not have all of the technical information, but they have a lot of, I guess, street smarts or inpatient smarts about how the business ought to run, and then they can test those ideas against other metrics.
Hi, thanks very much for your talk. I have a broad level question, I guess, about what you see as the future of labor in a larger system, which people tend to see. Sorry, let me start again. My question is about employment opportunities. And a lot of people think about future data-driven systems as fear them as sort of cutting jobs. And so I'm just curious about, given your work in the labor sector, how you think about those kinds of worries.
Yeah, there's a great Japanese saying that the auto industry learned the hard way many years ago. It's called, workers are the people who give wisdom to these machines. And I believe that applies in healthcare as well. Let me just give you the example. I'll give you a homegrown example, because my wife is a nurse practitioner, and she's out in the community serving hard to serve populations. And so they get tablets to keep track of their all the data and all the reports that they have to make. And she's constantly been frustrated that they are not listening to the people on the front lines for the kind of information that they need and the kind of reporting systems and how the design these fancy pieces of technology to meet the nurses' needs. And it took about a year before they finally started listening. And once they started listening, they redesigned the technology, and now it really works, and it really saves time, really gets higher quality information out there faster, helps her in her communication with all of the staff that she works with. That's the future of healthcare. So I believe, yes, technology is going to change jobs. It's going to eliminate, we don't have chart room workers anymore. But at Kaiser, they redeployed those chart room workers by retraining them, and they can be now moving into some other areas, and they can enhance their skills, so perhaps their earnings go up a little bit, or at least are protected. That's the way in which we need to manage healthcare, and that's the way I think technology will complement work. Yes, some jobs are going to go, not only in healthcare, but in other industries. But if we think creatively, and if you work with people like us who work with technology and the work system, or you listen to the workforce, you will find that they are ready to engage. They're afraid of losing their jobs, but if you put the right kinds of processes in place, you can deal with the job fear, and you can redeploy, and you can get the enhanced benefit of experienced people helping to make complicated systems work. So yes, there's going to be displacement. There will be some job loss. This is a growing